In this presentation, I will talk about the amalgam following step-by-step procedure. As I have mentioned in the composite following step-by-step procedures, I will do the same here, but in general steps, but there are some differences between the composite and the amalgam registration, but the general steps are almost the same. So that the first step is of course to do a quick history taking and examination for the dentition. And when I say history taking, I must be sure that this tooth has no spontaneous pain or continuous pain after the removal of the stimulus, so that I can be sure that this tooth will not need an endodontic treatment. Then I do a quick examination for the dentition and the intended tooth, because I don't need to do a fatal mistake and do a restoration for another tooth. Then I should check the occlusion and place of the contact areas, and that is very important to have a primary idea about the places of the contact areas, so that after carving and uh, putting of the amalgam restoration in the tooth, I will be able to carve correctly and properly, guided by the first idea that I have taken during this step. After that, I will do anesthesia, and of course for the upper teeth I will do an infiltration anesthesia, and for the lower teeth I will do a block of the inferior alveolar nerve. And as you can see in this picture, the anesthesia for the inferior alveolar nerve is very simple. We should palpate the anterior border of the ramus of the mandible by our thumb, then put our thumb on it, and in a line extending from the middle of our thumb to the almost 2 centimeters posteriorly, we inject our injection. Uh, this is the inferior alveolar nerve and the lingual nerve medial to it that we will anesthetize. After that, we do the isolation. We can do the rubber dam isolation, but we can also do the use of the high volume evacuators and cotton rolls or pads, so that we will isolate that tooth correctly and properly, because we don't want water to be mixed with the amalgam restoration, because that will lead to imbibition or increasing in the size of the amalgam, and of course fracturing of it or parts of it. After that, we will use the matrix bands and the wedges, and that is in the case of the interproximal caries only, so that we will not hit or do some damage to the adjacent tooth, so that this step is a prophylactic step. We have three types of bands in general: the universal band, the adult MOD band, and the pedo universal band. After that, we start our preparation. The preparation is always started by the use of a high-speed hand pieces with a round burr, diamond round burr. Guys, we should always prepare the enamel with a high-speed hand pieces and the use of diamond burrs, so that assuming that the tooth is not extremely distracted, and we should use a diamond burr, we will start with the round burr, and our start will be from the occlusal pits, mesial and distal one, and after that we will keep doing the outline form of the preparation by using the fissured burr. Guys, you should know that the use of the inverted cone burr in this step with the amalgam restoration is of a major importance because it will facilitate the formation of the retention form for the amalgam. This inverted cone burr will make an inclined surfaces of the tooth preparation so that they will retain the amalgam restoration. In this regard, I highly advise you to check the videos of the principles of tooth preparations that I have done, and there you will find more details about the principles of tooth preparation, but in general there are 5. You should do the outline form according to the extension of the caries or according to the presence of the old restoration if you are doing a retreatment procedure, and after that you should do and finish your outline form in a sound tooth structure. After that you should do a retention form, and when I say a retention form in the amalgam restorations, I mean the inclined buccal and lingual surfaces only, not the mesial nor the distal walls of the preparation of the tooth, only the buccal and lingual surfaces. They should be inclined by 6 degrees, and this is the primary retention form, of course, because you can use other retention forms. After that we should have the resistance form, which is by having at least 2 millimeter thickness of amalgam and tooth structure without stress concentration areas, because they will act like a stab in the back of the amalgam restoration, so that the pulpal floor here must be even, and if it is not even, you can make it even by the cement, so that the pulpal floor must be even and the gingival floor must be even, and that is to prevent the stress concentration areas and have a proper resistance form. After that we should have a convenience form so that the instruments can be introduced to the preparation, and finally the final finishing and cleaning of the restoration. And the final finishing and cleaning of the restoration is done by the use of the carbide burrs and hand instruments like the round or fissured carbide burrs and the enamel hatchet, etc. The final finishing and cleaning of the preparation should be like this. The tooth should be clean enough to accept the restoration. After that, and after the completion of the preparation, we remove the band and the wedge and place another band and another wedge in association with a retainer. In this case, here we should put a retainer if we are having an MO or DO or MOD preparations, so that this band and retainer will support the amalgam restoration and allow for its carving and burnishing and condensation procedures. The wedge, on the other hand, is of extreme importance because it will preserve the papilla space and interdental space and the gingival embrasure space, and will not to lead to overhangs, because if we do not put the wedge, there will be an overhang of the amalgam, and the overhangs of the amalgam will lead to periodontal disease, and that is the thing that we don't ever want. After that, And after the completion of the preparation of the tooth and retention of the tooth, we should do the pulpal protection procedure. And when I say pulpal protection procedure, I mean if we are close to the pulp, we should put a cement layer beneath the amalgam, and that cement layer will replace the dentin layer that acts like a cushion beneath the amalgam, because as we said, the enamel and the amalgam that replace it are brittle, so that there should be something uh, elastic beneath them, or has some elasticity, which is the dentin beneath the enamel and the cement beneath the amalgam. After that, we should know also that if we are so close to the pulp and we have a shiny pulp, we should do indirect capping procedure by putting the calcium hydroxide in that area only, so that we will induce the formation of the secondary dentin and remineralization of that area. After doing the pulpal protection procedure by putting the dical or calcium hydroxide in the very deep areas, and after that putting the cement above it, which is a must here in the amalgam restorations, we should always put a cement. Not like the composite restorations that we have said, we can not put the cement because it has some elasticity itself, the composite. An exception for this thing is when we have a very simple caries, class 1 caries, that is, we can do our preparation in the enamel only, and after doing the preparation in the enamel only, we can put only a varnish and then the amalgam above it. That is the only exception for the amalgam restorations, that we can put it alone without a cement. After making everything is okay, we use this thing, which is the amalgam capsule, and we push the plugger, the green plugger, so that the mercury, liquid mercury, will be introduced to the silver alloy. And after pushing the plugger, we put it in this machine, which is called as the amalgamator, and activate this, and this will be almost for 5 seconds, the time required for the mixing of the liquid mercury and the silver alloy to have the amalgam filling ready is 5 seconds, but that depends on the manufacturer instructions. So that, guys, you should always, this is very important, to read the manufacturer's instructions regarding any dental product that you use in your clinic. This is of major importance to have if you want to manipulate your dental products properly, and then you to have the most perfect result that you would ever want for you and for your patient, to say that you are a good doctor, you should read the manufacturer's instructions for any product that you use. Okay, so that here you should read the manufacturer's instructions that come with the amalgam capsules, and know the amount of seconds that they need to be ready. After that, you open the capsule and you put them in the amalgam well, and after that you use the amalgam carrier to take the amalgam that is ready now to be put in the preparation. After putting the amalgam filling in the preparation, you use an instrument called as an amalgam condenser. This amalgam condenser has a flat end or a flat face of the nib, and this is used to condense the amalgam in the preparation. Here you should do as much condensation as possible because this is very important to take out the liquid mercury from the amalgam. And when we take off as much mercury as possible from the amalgam, this will lead to two things. The first thing is when you are taking a liquid from something, you will have a stronger amalgam. This is the first thing. And the second thing, when you are taking off this mercury as much as possible from the amalgam, you are taking off the toxic part of the amalgam. So that do condensation as much as you can, because this will take off as much mercury as it could be, and that will lead to a stronger amalgam and a less toxic amalgam. But guys, be careful here, because if you are doing an extremely excessive condensation, you may fracture the tooth if it is weak. So that do as much condensation as you can, but with a limit, and do not fracture the tooth. After that, you should do a burnishing and evening procedure of the condensed amalgam. After putting the amalgam in the preparation and condensing it, you should make it even, and that is by the use of an instrument called as an amalgam burnisher with this ball head. After doing this primary burnishing procedure to the amalgam, it is ready now to be carved, and the amalgam is carved by an instrument called as an amalgam carver, which has a knife shape picture. This amalgam carver is used with the following thing. Guys, listen to me. You should always put the head or nib of this instrument parallel to the surface that you are carving. You should put it parallel to the surface that you are carving. Look at the distal picture here. We can see that the correct way to carve the amalgam is by putting the carver parallel to the surface of the amalgam that we are carving. Not too much vertical, not too much horizontal. Okay? This is very important to do the correct carving procedure. And if we are assuming that we are carving the buccal cuspis in this picture by putting the carver parallel to the lingual aspects of these buccal cuspis, now if we want to carve the lingual cuspis, we should turn the carver and make it sleep on the facial aspects of the lingual cuspis, so that after making the carver sleeping on the lingual aspects of the facial cuspis, then we will turn the carver almost by 45 degrees and make it sleep on the facial aspects of the lingual cuspis and start carving these lingual cuspis. Okay, this is the correct carving procedure. And after doing this carving procedure and after having the cuspis and anatomy that you have, you do the secondary burnishing procedure. And I really like this beautiful instrument because it does carving, it does burnishing very well, and carving of the developmental grooves very well too. Not developmental because it is not a tooth, but I mean the grooves in the amalgam, they will be very nice. After the completion of the condensation procedure, primary burnishing procedure, carving procedure, and secondary burnishing procedure, the amalgam is ready now to be checked for the occlusion. We should check the occlusion by the use of the articulating paper and see the high spots in it by asking the patient, are you feeling some piece of stone or any abnormality between your teeth? If he says yes, that means there is a high spot. If he says no, that means there is no high spot. So that if there is a high spot, that will be like it will be like an uneven or abnormal pigmentation on that area of the tooth, or it might look like if we are having a pigmented spot and a depigmented spot inside that pigmented spot. That means the area is pigmented, and because of an excessive pigmentation, because of that high spot, that area is depigmented. That area that I mean is in the center of the pigmented area. After 1 day, the amalgam restoration will be hardened and set completely. In this case, we should do the final polishing and finishing procedure by the use of the rubber caps and pomace. I'm kidding, of course we will not use that pomace, but we will use the dental pomace. And I prefer in my clinic to use this single-use pomaces because they are disposable and they will prevent the occurrence of infection, because when we use that big container, I think that we inevitably might have some cross infection or something like that. So that anyways, I prefer to use this single-use pomace, or we can use the Profi brushes also with the pomace to do the final finishing and polishing procedure to the amalgam. Guys, you should know here that you should use water. Use water, because the excessive friction of the brushes or the rubber caps with the presence of the abrasive pomace, there will be a huge amount of heat, and this huge amount of heat will lead to pulpitis. So that you don't want to your patient to come to you and tell you that you're a bad dentist or your filling was a failure thing, because the pain is continuous and he does not know that you have worked so damn hard to do this restoration, and the mistake is not in the restoration but in the finishing and polishing heat that led to pulpitis. So that be very careful here to use water with the rubber caps or brushes with pomace to prevent the occurrence of pulpitis. Step summary are to do a diagnosis to the intended tooth, anesthesia, and isolation to the tooth. After that, we prepare the tooth and put a band, retainer, and a wedge around it. After that, and lastly, we do the pulpal protection procedure, place the amalgam, check occlusion, and finish and polish it one day after. Thank you for improving yourself by listening to this presentation. Always try to know, try to spread knowledge, and try to construct the world. Try to be kind to others because life is not short, but it is limited, and that is for the greatest benefit to the humankind.